The efficacy and safety of these drugs are really hard to assess in diseases like TTP because it's a rare disease, and even a more rare subset of patients need this type of patients in the preemptive setting. So it's really important to have like large databases and more data on these new and innovative drugs. The two results we have found 7 patients who received Daratumumab in France for immune-mediated thrombotic thrombocytopenic purpura. And these patients seem to be profiting from this treatment option. So in these 7 patients, 9 episodes were treated with Daratumumab, and it seems to be an effective therapy. These patients were heavily pretreated, so they usually received multiple lines of Rituximab and other preemptive treatment strategies due to relapsing ADAM13 activity or clinical relapses or refractoriness or intolerance to Rituximab. So most of the patients received Daratumumab due to refractory disease. And even in this really hard to treat subpopulation of the patient, we found that it is really effective. 7 patients reached the normal ADAM13 activity after Daratumumab administration. 5 patients reached an almost normal activity, so that we consider safe activity in terms of preventing clinical relapses. So they reached ADAM13 activity between 20 and 50%, and there was 1 patient who was completely refractory to this therapy. And there were 2 patients who were retreated with Daratumumab for the second time, and even in these cases it seemed to be effective. So I think in this hard to treat population it can be an effective therapeutic option. And it seems to be safe. We only found infusion-related reactions with Daratumumab that were manageable with the standard of care therapy, and there were no need for like hospitalization or other more advanced therapies.